Hi, Dr. Becky here. In this video, I want to talk about working with insomnia, and it's the first of a few videos that I'll do in this series. As always, realize that this is not therapy. It's intended to be educational. So if you have any questions about how the techniques might apply to you, be sure to talk to your medical or mental health provider. So first of all, some facts about sleep. There are 4 stages in the sleep cycle. Stage 1 is that initial drowsy phase where your mind begins to unwind and your thinking slows down. You may still be aware of your environment, but you're in that first stage of drowsy sleep. And then the second stage is also considered a lighter stage, but your body relaxes more, your mind slows down even more. Stage 3 is the deep state of sleep. It's one of the stages where we get that restorative benefit from it. And then the last stage is the REM stage. And this is the dreaming stage. And this is also a restorative stage of sleep. So we cycle through these stages throughout the night, and each cycle starts at about 90 minutes, and then it gets a little less as time goes on. We get most of our deep sleep in the first hours after going to sleep, and we get most of our REM sleep in the later hours or closer to when we wake up for the day. So here's a few interesting facts about sleep. The first one is that we all dream, even the people who don't remember their dreams. So if you don't remember your dreams, you're in good company, but you do dream, and it's an important part of the sleep cycle to be able to do so. Another fact is that even good sleepers wake up multiple times a night, in fact, about 6 times a night. Most of the time, those periods are so short that people don't even remember it the next day. So a lot of times you'll think you slept through the night, but in fact, you have had some awakenings. It's usually during those awakenings that your body lets you know that you need to hit the restroom, if you're somebody who needs to do that in the night. And if you're able to get up and do your business and then come back to bed and reasonably get back to sleep, that is not what we call disrupted sleep, because again, you just start that cycle over again. Another fact is that for average sleepers, which is most of us, it's typical for a person to take 10 to 20 minutes to fall asleep after laying down. Another interesting fact is that sleep is an ability. So just like other abilities, some people are gifted at it. So you probably know someone who is able to do all of the, quote, wrong things and still sleep well. Somebody who can drink a strong cup of coffee and put it on the bedside and then go right to sleep. Or someone who can have an argument with a loved one and still get a good night's sleep. Or someone who can sleep in any position, in any bed. These are gifted sleepers. Especially, we think of giftedness as something that's always been there, something that you came into this world with. We come into the world with abilities, and again, sleep is one of those abilities. So on the opposite end of the spectrum are people that struggle and maybe have always struggled with sleep. If this is you, you probably have trouble turning your mind off at night. That's one of the number one things I hear in talking with people who have trouble sleeping, is that they have a hard time quieting their mind. For folks who are on the gifted end of the spectrum, it takes a lot more to trigger a bout of insomnia, though even those folks might have a bout or two throughout their lifetime. For those on the other end of the spectrum, it may not take as much to trigger a bout of insomnia. Now, insomnia can be defined as trouble getting to sleep, trouble staying asleep, or waking up early and not being able to get back to sleep. Insomnia can be acute or chronic. So acute insomnia means a new onset, a newer bout, and chronic means that people generally most nights have trouble sleeping. Many people have bouts of insomnia throughout their lives. So if you've had a bout of insomnia, you're in good company. Most people do. For most people, those kind of average sleepers and gifted sleepers, a bout of insomnia doesn't last that long and often goes away by itself. The things that trigger a bout of insomnia tend to be things like stress, illness, injury, change in medications, those kinds of things. Another fact is that it's often the things that we do to try to make sleep better that actually makes the insomnia last longer. So it's counterintuitive, and we'll talk about that in another video. With sleep, in some ways, trying to sleep never works. And if you've had insomnia, you know that. The more you try, the further away it gets, the harder it is to be able to allow your mind and body to relax and drift into that first stage of sleep. So we'll talk more about those things that don't help so much and then some strategies of things that do help. With sleep, again, less is more, and there are things to be able to put yourself in a position to allow sleep to happen. If you're having trouble sleeping right now, even if you've had insomnia for a long time, I want you to take heart because it can be better. If you've never been a gifted sleeper before, you're not going to become a gifted sleeper. The idea that good sleep means that you lay down and you drift off immediately is not normal sleep. It is for the gifted folks, perhaps, but not for most of us. And most of us are average or have some difficulty. So the goal of working with insomnia is to help learn strategies to put yourself in a position to allow yourself to enter that drowsy state easier and in a way that allows you then the other stages of sleep to do their work. So take heart, it can definitely be better. The goal is better, not perfect. So I hope these facts are encouraging and maybe dispelled a few myths that you had about sleep. And so come back and we will work together more on how to help sleep be better.